Morning, everybody. So today I'll be discussing polypharmacy in older adults. What it is, why it matters, and how we can better manage it. Polypharmacy refers to simultaneous use of multiple medications typically defined as taking five or more. However, it can also include any combination of medications that might cause harm or fail to provide clinical benefits. It's essential to recognize that polypharmacy raises the risk of adverse drug reactions, frailty, functional decline, false cognitive impairment, and even mortality, especially in older adults living with frailty or other geriatric syndromes. So, now we go to the incidence and impact. The prevalence of polypharmacy is increasingly alarming, with many older adults taking multiple medications. For instance, it's reported that around 66% of people aged 65 or older take more than three prescriptions a month. Many community elders take more than five prescriptions a month. So why are older adults at higher risk? Older adults are particularly vulnerable to complications of polypharmacy due to psychological changes such as altered drug metabolism and exertions. As we age, our bodies change. We decrease renal clearance, changes in body composition, and reduce hepatic function. Older adults are at higher risk for adverse effects from medication. Factors such as multiple chronic conditions, various prescribers, cognitive impairments, and frailty add further complexity to the treatment. So, for the consequences of polypharmacy, they are significant. They include adverse drug reactions, increased hospital admissions, falls, and a decline in physical function. Certain medications are particularly higher risk for all older adults, including CNS acting drugs like benzodiazepines and antipsychotics, opioids, and some cardiovascular drugs. So, for screening assessment, to address polypharmacy, we need effective screening and assessment tools. Conducting a medication review using methods like the brown bag assessment can help us identify what patients are actually taking. We can also use criteria such as Beer's criteria, stop, start guidelines, and the drug burden index to pinpoint potentially inappropriate medications and assess their functional impact. So now we go to the non-pharmacological intervention. For non-pharmacological interventions, they are crucial to managing symptoms without relying solely on medications. This involves carefully tapering medication when appropriate, coordinating care among different providers, and educating patients and caregivers about their medication. For conditions like insomnia or anxiety, for example, cognitive behavioral therapy or physical activity may be effective alternatives to medicine. When it's necessary, we can start with lower doses and consider renal and hepatic function when making adjustments. It's essential to regularly review the necessary and effectiveness of ongoing medications, looking for safer alternatives based on recognized guidelines. We must be vigilant about monitoring for any adverse effects and drug interactions. So, what are the practical steps for this de-prescribing? When de-prescribing in a clinical or hospital setting, we follow a couple of structures, approaches. For example, we review all medications and their indications, identify potential inappropriate medications using the beer and stop criteria, focus on medications that are harmful and have no current indication or provide minimal benefit. We gradually taper off medications as needed while monitoring closely, and we ensure patients and caregivers are educated and have a follow-up plan. So, what are the outcomes and evidence? The evidence shows that coordinated medication review and de-prescribing interventions can significantly reduce falls, hospital admissions, and improve overall function in older adults. However, we must keep in mind that ongoing evaluation of these interventions is essential to ensure their effectiveness. In conclusion, polypharmacy is a multifactor geriatric syndrome prevalent among older adults, increasing the risk of various adverse outcomes. By implementing systematic periodic evaluation of medications using tools like peer criteria and drug burden index. Alongside this de-prescribing and non-pharmacological therapies, we can reduce harm and enhance health outcomes for older adults. Thank you for your attention, and I look forward for any questions that you may have.